In a world obsessed with celebrity, we often overlook those who make tangible contributions to society. In the City of Saints, Dr. Santhia is just one of many do-gooders who touch the hearts and lives of Grahamstonians on a daily basis. Despite being on call 24/7, Santhia speaks fondly of his work and considers interacting with and helping his patients at his surgeries, state clinics and Selfless Hospital a privilege.
It was not a choice that I had made myself. I was planning to go and do teaching. And then the vice principal at our school, high school, thought otherwise. He made the application for me, did everything. And I was just sent into medical school, and I enjoyed the studies, enjoyed working as a student in the clinics, and I enjoyed the practice of medicine ever since. So it's an amazing thing. It worked out just right for me. As far as I'm concerned, my work is my holiday. I enjoy doing what I do.
As a founding member of the Grahamstown Health Forum, an organisation who rank the establishment of clinics and daycare centres for the less fortunate among their achievements, much of what Santhia does is at the cutting edge of medicine in this region.
When the mother-to-child transmission, prevention of mother-to-child transmission of HIV became a topic of interest in the medical field, I bought antiretrovirals and left them at the hospital to give to the mother and to give to the child. And actually, I asked them at the maternity not to tell their administrators, because at that time government they didn't approve.
Santhia himself has a long history of going against government, having treated wanted political activists behind closed doors during apartheid, even though it posed a threat to both his family and his practice.
Sometimes there are certain things you do without thinking of consequences. If they went to the hospital, someone at the hospital phoned the police will just pick them up. And then amazingly, when they used to come to my rooms, the police used to come 10 minutes, 15 minutes later. So I was harassed by the police at times on that. When the exiles, when they returned, when I used to examine them, a lot of them had mental stress over the years, and we used to discuss it. I used to also give them free medication because they were just coming, no jobs, and even some of them even buy food, giving them money for food because they didn't have anything.
Despite his contributions to society, Santhia remains humble and feels as though he merits no praise.
I was nominated twice for the Grahamstown Citizen of the Year, and I declined. There are two things that I was a little hesitant with: unsung and hero. I'm not a hero, and unsung is something that says that you need to be praised. One thing I earned a sufficient or a significant financial reward for what I'm doing, and whatever I do outside my, hasn't taken a significant portion of my income. There's a lot of really unsung heroes in the townships, in the community, that you and I don't know about, and I haven't done an inkling of what I feel an unsung hero is. So that's the title is not apt as far as I'm concerned.
Mm-hmm. Perhaps role model is more apt a term to describe Santhia, as one can hardly deny that his benevolence has a lasting impact on the world, unlike the indulgences of those who caught the limelight.